Hi, my name is Lia Barros, and I have my doctorate of nursing practice, and I work as a nurse practitioner at the University of Washington in the Pulmonary Vascular Disease Clinic, and I'm a PAH specialist. I'm so thrilled that you're here, and today we're going to talk about understanding pulmonary arterial hypertension. Before we get started, I do want to share that this presentation is sponsored and made on behalf of United Therapeutics. As a speaker for United Therapeutics, I am therefore compensated by them. The information today is here for educational purposes to help support a relationship between patients and their clinicians. This is not intended as medical advice, and I do encourage you to please always discuss your own personal results and questions with your clinical provider. For the purpose of today's talk, we're going to learn about PAH. First, we'll talk about what is PAH? How do we monitor when we're living with pulmonary arterial hypertension? What does treating PAH look like? And probably most importantly, what are the things that you can do? Okay, so PAH. What is pulmonary arterial hypertension? Before we get started, I want to make sure that we all understand how the heart and the lungs work together as a team. So, blood flows into the right side of the heart. That heart contracts and pushes blood through the pulmonary arteries to the left side of the heart. The heart contracts again, and blood pushes out to the body, bringing oxygen to all your vital organs, and then returning back to the right side of the heart, where the cycle repeats itself. So blood flows into the right, through the pulmonary arteries, into the left, out to the body, and the cycle repeats itself. The left side of the heart, therefore, receives rich oxygenated blood that is coming from the pulmonary artery. When this cycle repeats and the blood comes back into the right side of the heart, you've used up that oxygen, and so now you have blood that's coming in and getting ready to go to the lungs. Pulmonary arterial hypertension is a disease of blood vessel narrowing. So your blood vessels start to grow in on themselves as well as thicken and squeeze that vessel tighter. So now blood that's moving from the right side of the heart through the pulmonary arteries to the left side of the heart has a harder time doing this. As those vessels narrow, that pressure rises. And when pressure rises, that resistance goes up. And now the heart is working extra hard to get blood from the right side of the heart through the narrow vessels to the left side of the heart. And over time, if that goes untreated, less blood will make it from the right to the left. Less blood will make it out to the body. And the right heart, over time, will continue to stretch and make it harder and harder to do its job. An analogy I like to use with my patients is thinking about PAH like a highway. Here in Seattle, we have the famous I-5. Early in the morning, you have nice normal flow of traffic. But in the summer, which is the only time we do construction, is we only narrow down those lanes to 2 lanes. And that same flow is now being forced through 2 lanes, increasing that congestion. And the words we use is resistance. So as those lanes become less and less, and there's less space for the cars to move through, the resistance rises. And this is the same thing in PAH. As those vessels narrow, that resistance rises. And why does it matter? Well, because when PAH causes resistance, remember, this puts strain and stress on the right side of the heart. So those narrow blood vessels in the lungs tighten, and the right side of the heart is pushing against that high resistance. And as it does it, it will start to stretch, and now it's trying to do its job all the way out here. And what does that mean for you? Well, you're going to start having symptoms, and I probably don't have to be the one to tell you what those are. But one of the most common things that people will describe to us is this difficulty or this shortness of breath. And is it at rest or is it when you're moving? So when you get up and you try to walk across the room, right? We've all done it. Take that diuretic and you got to rush to the bathroom. And suddenly you're asking your heart to do more work. And when you're living with PAH, the heart has a hard time moving the blood through the arteries to the left side of the heart, and you feel short of breath. You also might develop rapid or irregular heartbeats. Maybe when you exert yourself, you start noticing that you have chest pain, or even more commonly, chest pressure. Depending on your physiology, you also might start to develop swelling or distension in your abdomen. You also might notice swelling in your feet, your ankles, or even your hands. While these are not all the symptoms of PAH, these are the most common ones. Over time, these symptoms will make things harder to do. Everybody, we ask you to do a 6-minute walk test every day you're at home. Maybe that's the thing you do, like laundry, and you start to notice that lifting heavy loads of laundry becomes harder. Bending over to lift the laundry out of the washer to the dryer becomes more difficult. Suddenly, the walk you always take with your dog, you can't go as far as you used to. Or when you hit the incline, you really notice more shortness of breath. The stairs is an excellent space to understand because it's something that you can measure. I used to be able to go up 3 flights of stairs, and now I can only go up 1. I used to go up 8 single steps before I'd have to rest and catch my breath. Now I only go up 2. And so you'll notice that as the heart has a hard time and you experience these symptoms, everyday tasks are something that become more difficult. PAH, it's a disease of blood vessel narrowing. When this happens, blood has a hard time moving from the right to the left side of the body, and the heart becomes larger and struggles under stress and strain, and you feel worse. Tests are how your specialist monitors your PAH. As you can see, there are many common tests and assessments, and I'm sure many of you are already familiar with some, if not all of these. The right heart catheterization is so important because this is the only way we're able to formally diagnose pulmonary hypertension in general and PAH specifically. This procedure measures the pressures inside your heart as well as inside your pulmonary artery, giving your specialist a direct understanding of how well controlled is your disease. Echocardiograms are another fantastic tool that help evaluate how well is the right side of the heart keeping up and functioning in the setting of these high pressures in the pulmonary artery. Functional class symptoms, your clinician will ask you many questions. This is a summary, really, of your symptoms. Are you feeling short of breath when you're at rest? What activity does it take to solicit your symptoms of shortness of breath? Do you have lightheadedness? Do you have chest pain? We put all of this together and we put them into functional class of your symptoms. Blood tests, the BNP and the proBNP, become an important marker that tell us how well is your heart keeping up. So we have to remember that heart is a muscle. And as that heart gets stretched or is under stress or strain from too much pressure or too much fluid, we begin to have an enzyme that leaks out of the heart. It goes into the blood, and we can measure that enzyme, and we call that the BNP, or one step above the NT-proBNP. So this gives your clinician information about how much stress and strain is your heart experiencing. And of course, the dreaded 6-minute walk test. This is helping your clinician understand how well can your heart keep up with exercise. How fast does your heart have to beat to accomplish this distance? What distance can you cover? And what happens to your oxygen levels when we put you under exercise? Your PAH specialist will hopefully be able to compare these results over time. I like to think of this as a puzzle. Each piece of information helps be put together to show us the puzzle of how well is your disease being controlled, or how severe is your pulmonary arterial hypertension. And of course, a moment in time is not as helpful as looking at these things over the arc of your disease, right? Comparing the distance you walked before to the distance you walked today. And did we change anything in between those two studies? Looking at what was your BNP and what is your BNP on treatment? What is your BNP in 3 months, and 6 months, and so forth. So looking at these studies over time is what helps give your clinician understanding of the severity of your disease. So we use these somewhat as benchmarks as well when we're comparing them to understanding also the literature and what that means for the person sitting right in front of us. These test results, as we were talking about, become even more powerful when you put these all together. And again, I like to think of this as a puzzle. And when we put each piece together, what is the bigger picture of your pulmonary arterial hypertension? Somebody took the time to say, what if we bring all these pieces together? Can it help us understand the severity of a patient's disease and therefore a prognosis? And from that question, they looked at patients living with pulmonary arterial hypertension, and they developed a risk assessment tool, or something we will call risk status. And they developed an assessment that says these pieces in the puzzle, when put together, suggest that this patient has low-risk disease, or intermediate risk disease, or high-risk disease. And then we went on to say, well, what does that mean for patients living with PAH? And we did several studies, and really what we found is that patients with low-risk features of disease, or patients who are able to start on therapy and move to low-risk features of disease, have a better prognosis. And so the guidelines and specialists working in the field of pulmonary vascular disease will use risk assessments to help us understand what therapies and how many therapies do we need to try to move you closer to low-risk features of your disease. Because we know that those are the patients that have a chance at the best prognosis, have a better life expectancy over the course of the 5 years, and are likely able, and what I think is the most important, do more, achieve those goals that you set for yourself. We know that PAH is a disease of blood vessel narrowing that causes right-sided heart failure. We know that those are symptoms and that there are many tests that providers can gather to put together to understand how severe is your disease and what is your 5-year prognosis. What does that mean when we think about treating your PAH? Let's first talk about what is happening in the body when you have pulmonary arterial hypertension. So, a person living without PAH, with healthy blood vessels, requires a balance of naturally occurring substrates in the body. We need a little more of some and a little less of others. And it's this balance of these substrates that keep our vessels healthy. And when I say healthy, I mean nice and big and open the way they're supposed to be. Now, patients living with PAH get an imbalance of these substrates. You have too few of some and too much of others. And this imbalance is actually what drives the growth and the narrowing of the blood vessels. So we try to target balancing back out these substrates to see if we can open those vessels back up. So while there's currently no direct test to know which of these substrates do I have too much or too little, We do believe as specialists that everybody living with PAH has some imbalance of these substrates. I like to think of this imbalance sort of like the alignment in a treatment pathway, like tires on a car. So we have nitric oxide, we have prostacyclins, endothelin, and activin signaling. If you think about this, we need the right amount of air in each tire in order for our car to operate smoothly. And therefore, we target each of these individual substrates with different therapies. We target nitric oxide, we can target prostacyclin pathway, we can target the endothelin pathway, and we can target the activin signaling pathway. And I think that this is really important for my patients to understand, because then they can understand, why is it not that we start one medicine and then maybe we replace it with something else? And why is it that we add subsequent medicines, right? I think a really hard thing for patients is that they were living without disease, and now suddenly they're being asked to take 2, 3, 4 plus medications, pills that are 2, 3 times or more a day. And this shift for people, I really like to root in understanding why it's important to target each of these pathways and keep your car running smoothly. How do your specialists decide which pathways to treat? Well, we've done studies, and we looked at targeting different pathways and in different combinations. If we target simply one pathway, 2 pathways, or 3 pathways up front, how well do patients living with PAH do? So most patients with PAH have at least 2 or more substrates out of balance. And if several tires were deflated on your car, would you keep driving or only fix one? No, you would fix all the tires so that the car can run smoothly. That is why we treat multiple pathways. Sometimes I like to think of this as roads. All the roads are leading to the same party. They're just taking a different way to get there. So we did studies and we said, what if we start patients living with PAH on just one of these therapies, targeting just one pathway? And we compare them to a group of patients where we target 2 of those pathways. And we found that patients who are being targeted on 2 pathways did better than patients who are only targeted on one pathway. And so these studies have helped inform the guidelines, which guide your specialists to determine which medications to start, how many to start, and what they need to do to target and to move you to low risk status. And then they use those test results we talked about. They use the echocardiogram. They ask you how you're feeling and put together your functional class symptoms. And they put together each piece of your puzzle to understand, are you low risk status? And what is the next steps to making sure or ensuring, if it's possible, that you move to low risk status? So what can you do? I think it's really important that you make sure that your treatment plan is customized to your unique PAH and your goals. I'll say that every single time, my goals are not the same as my patient's goals. My goals are that the right side of the heart is able to do its job, or that the pulmonary pressure comes down, or that you can walk further on the 6-minute walk test. But I have never had a patient sit across from me and tell me that they hoped the right ventricle was smaller. But I do have patients sit across from me and they tell me, I just want to be able to go to my grandson's football games again. And I have to take those stadium stairs, and I haven't been able to do it for the last 3 years. I just want to go on this cruise that takes me around the world with my family. We've planned for a lifetime. I just want to be able to walk my dog around the park because that's what brings me joy. And so making sure that we're, both as your provider and for you as a patient, that we're understanding and speaking the same language to make choices to help you get to those goals. So continue to ask your specialists about how this treatment plan is helping you achieve those goals and how that may change over time. As your clinician puts together your pieces in the puzzle, they may feel that adding or changing a therapy would help move you to low risk status. Also, supplemental therapies. Do you need oxygen therapy? Diuretics? And of course, lifestyle changes. How can we help improve that you're on a low sodium diet, that you're limiting your fluids, that you're getting regular exercise, all the things that are going to help you increase your quality of life and live longer. That means there's things that you can do. What are those? First of all, you can find a PAH specialist if you haven't already. Why do you need a PAH specialist? Well, these are clinicians that are specialized in training and experience taking care of patients living with PAH. I think something we need to remember is that PAH is a rare disease. And so for somebody only seeing it once in a while, it's hard to understand the complexities and the nuances and how that shows up in decision making. And so working to find a PAH specialist who also partners with your local expert, your local pulmonologist, your local cardiologist is really important. PAH specialists have education and experience in prescribing therapies, understanding and interpreting the tests that we talked about, and also assessing and understanding the research. And I think most importantly, how does that research translate to you? So if you need help finding a PAH specialist, the Pulmonary Hypertension Association right here on the QR code will take you to the link where they have PAH specialists around the country. Make sure that you're talking with your team. You've landed in specialty medicine. We want to know. If you don't tell us, then we can't help you. So make sure on your part that you're tracking how you're feeling. Remember those activities we talked about? Those are 6-minute walk tests you do every day. How are those stairs? I used to be able to take 10 stairs before needing to stop and to catch my breath. Now I can go up and down 3 times. I used to be able to walk my dog up the same hill or out to my mailbox, and that's become harder. So monitoring these everyday activities helps you understand how well controlled is your disease and is important information that your clinician wants to know if you're having changes. Some questions you could consider asking is, when was the last time that I felt back to my baseline? How do my daily activities now compare to how they used to be? And what solicits my symptoms? When you're in your clinic visit, make sure you're asking about your treatment plan. You can ask about, what is my risk status? Is there anything I can do to improve my prognosis? Is there anything I can do to move me to low risk status? Is there a way that I can achieve these goals? Is there something I can do differently or more of to feel better? And of course, the time in between these appointments. I think that when you're diagnosed with pulmonary arterial hypertension and you're living with chronic illness within the healthcare system, there's a lot of autonomy that you lose. There's a lot of sort of individual decision making that no longer becomes something you have the privilege to have every day. You have to take these therapies, you have to take medicines, but there are things that are in your control. And I really like to work with my patients to say, where are the spaces that you can take back that autonomy? Where are the spaces where you get to be empowered to help yourself feel better? And I think that is the work between those appointments. Is there ways to lower the sodium intake in your diet? Is there ways to lower the fluid intake? Can I step on the scale every morning and take control of what is the water weight that I have? What is the emotional support that I need? Am I making sure that while I go to all of these medical appointments, that I'm also seeking out professional support for my emotional health? Am I talking with my community and my family about what I need or what I'm experiencing? I think I don't have to be the person to tell you that this can be a scary diagnosis. It can come with feelings of overwhelming sadness or grief. And it's important that we make space for those. And it's important that we process those, because that is what's going to bring back quality of life as we're living with PAH. And all of this is work that you can be doing between appointments with your specialists. Engage in exercise. Research has shown that regular exercise leads to improvements for how you feel when living with PAH. This is probably one of the most common things my patients come and talk to me about is how much exercise can I do? And the thing we have to recognize is that there's some fear and anxiety that comes with exercising, because when you were going through this diagnosis, anytime you try to exert yourself, you might feel lightheaded, you might feel short of breath. And so now relearning what is the right amount of exercise that's healthy and not harmful is a big important step when living with PAH. And so I will guide my patients and I'll often say to them, listen, if you're pushing yourself and exercising and you develop lightheadedness and feel like you're going to pass out, too much, do less. If you feel like you're getting chest pressure or chest pain, too much, and do less. And if you're pushing yourself and you get so short of breath that you can't recover that shortness of breath in 5 to 10 minutes, it's too much, and do less. We are thrilled now that the guidelines also support and recommend pulmonary or cardiac rehab. This has been an excellent exercise program that helps give patients back confidence, helps give them skills and tools to reintegrating exercise, and has been shown to improve quality of life indicators. So if available, ask your clinician if that cardiac rehab or pulmonary rehab is right for you, and if there's something locally where you can engage. What you eat matters. PAH affects every element of your life. A high sodium diet and high fluid intake causes an increase of that fluid and sodium to pull water into your vessels and can worsen your right-sided heart failure. So a low sodium diet, limiting your fluid intake, will help you feel better. That's the powerful payoff. Is we talk about, oh, I can't have all of these things that I've enjoyed, my charcuterie boards, my soda that I like. And instead we can talk about, what do you gain? And what you gain is that you can do more physically. Maybe you don't feel as short of breath because your heart isn't having to work so hard to push all that extra fluid and sodium around the body. And so what you eat and what you take in matters. So educating yourself, and I think right here, soliciting your community, pull people in. Low sodium is good for everybody, so the whole house gets to eat low sodium. Or asking your friends to prepare freezable meals for you really helps people engage in supporting you living with this condition. Take care of yourself. We've already talked a little bit about some of the very real emotions that come along with diagnosis of PAH. Taking care of your mind and your spirit is important. It is common that patients who have been diagnosed with PAH suffer from anxiety and report symptoms of depression. Fatigue, it's a symptom of heart failure. It's also a significant symptom of depression. So continuing to check in on yourself, continuing to ask your community to check in on you about, are you having feelings of hopelessness? Are you having feelings of depression? Is your fatigue worse, right? Despite everything else getting better, are you feeling tired? And what can we do? How do we get help? Do the things you love. What is all of this for if you can't go back and you can't continue to do the things that bring you joy in your life? Maybe those are things that help your emotional health. Maybe that's meditation. Maybe that's listening to podcasts or writing in a journal. Maybe that's getting back to woodworking. Maybe that's taking a class, an art class, or reading books, or really spending time with the people you love. So making sure that in sort of the chaos of all of the appointments and the tests, that you're really making space, and that as clinicians, we are making space on supporting you to do the things you love. In summary, your risk status can provide information for you and your clinician to help guide your treatment plan. PAH is a disease of blood vessel narrowing that is caused by an imbalance of these substrates, and that treatment is trying to target rebalancing these substrates back. Treatment plans will often need to change over the arc of your life living with PAH. And the things that you can do in between are critical for maintaining your quality of life and how you feel. Thank you so much for tuning in and joining us today. If this information was helpful, please consider joining the PAH initiative at jointhepahi.com. Thank you, and I hope you have a wonderful day.